Hi, I'm Dr. Kevin Mailo, and you're listening to the Physician Empowerment Podcast. At Physician Empowerment, we're focused on transforming the lives of Canadian physicians through education and finance, practice transformation, wellness, and leadership. After you've listened to today's episode, I encourage you to visit us at phys-empowerment.ca, that's PHYS, empowerment.ca, to learn more about the many resources we have to help you make that change in your own life, practice, and personal finances. Now on to today's episode. Hi, I'm Kevin Mailo, one of the co-founders of Physician Empowerment. Tonight we're hosting a webinar. It's a beautiful summer evening out there, and I'm not going to keep this too long because I'm headed off for some water skiing for the first time this year. Yeah, so I'm really happy about that. And I'm very happy to have my fellow co-founder here as well, Dr. Wing Lim. And tonight, what we're going to be talking about, Wing and I are going to be discussing wealth mindsets. I think this is such an important topic for physicians because many of us have access to knowledge. Many of us have access to credit. We have high incomes to invest. But one of the things that, I found over this journey of educating physicians in finance is that there's a lot of facts, knowledge, and information out there in the world. We can go on the internet and find that very easily. But wisdom and experience are in short supply. And so we try to hit to some of these deeper notes by covering some of these more profound topics. And one of the ones that we want to discuss, and only in brief, because there are entire books written about this, is the notion of wealth mentalities. And I'm interviewing Wing today because it's really exciting to hear his journey. And if you want, you can go back to one of our founding episodes to hear Wing's entire origin story. But in brief, Wing, you started out as a family doctor in general practice in the early 90s, kind of doing it all, hospital-based, clinic-based, psychotherapy, delivering babies. You did it all. Why don't you tell us, just to start, the first question I got for you is just tell us a little bit about your journey.
Yeah, so I'm a U of A graduated a long time ago, early 90s. Yes, that was a time when practices were given away because people were leaving the province. There was a guy called Ralph Klein. Those are called the Ralph-onomic days for those who knew about Alberta. And I lost 98% of my classmates to US. So it was a 2% that stayed behind. Anyways, practices were given away, but I was crazy enough to have actually bought a practice with money that I haven't got. So it was a solo practice, and there is a built-in lab. Those days, you can still have a lab in your clinic and bill for venipuncture, believe it or not. And I have an X-ray clinic next to me. So I'm running like a mini emergency department. I loved it. So bought it, ran it, 100% ownership. And my wife gave up her career. And so we built a clinic together at 100 hours per week. So that was the starting point.
Yeah, so that's a lot. So you're working these long hours. You're struggling to balance tax payments, overhead, your time. You've got a young family. You're in the thick of it. And let's flash forward to where you're at now, as a family physician with a great practice still, but you also are a real estate developer, having originated over $100 million in new developments. And, take us through a couple of the highlights on that journey. And obviously that's not going to be the whole journey, but take us through some of the points where your mind changed, right? There's something about you along that journey that changed.
Yeah, I think point number one is going to the school of hard knocks. You got hit by the upside of the head really fast. At least at my med school at U of A, there was 1 hour of teaching on health economics. Is not about your personal health economics. It's about the hospital budget, provincial budget, bored to death, that kind of stuff. So personal finance budget, how you bill, we didn't even know we have to save money for tax. So that was first smack on the head. Then very soon we got evicted. The landlord took over and doubled our rent. We went to court, lost the place. So we spent my firstborn child, he's 25 now. So anyway, we spent the first Christmas at a construction site because we got evicted right around Christmas. So that was another smack of the head. So we were running as hard as we could. And then we were stuck and kids were coming. We got 3 kids within each 18, 19 months apart, right? So my wife cannot work as hard. I couldn't work as hard. So how are we going to do that when we keep trading time for money? I feel like I'm on a treadmill and running faster and faster, like a stress test where Bruce protocol, I'm ready to fall off. So that was a wake up call, rude awakening. And then a critical mentor. They say when the student's ready, the teacher shows up. So my mentor, Dr. George, he's still a friend of mine now. He's in his 80s. And Dr. George asked me a critical questions that decompression decompressed my mind. And he said that he asked me, Wing, how would you like to make 100% of one person versus 1% of 100 people? I said, can you repeat the question, George? I'd done very well 100% of one person at 100 hours per week, and I'm going nowhere. Right? Everything I went to school for, I was doing. And I thought I should be actualized, I should be happy, but I got stuck, right? And with just trading time for money thing is not working out. So when he asked 1% of 100 people, that decompressed my brain. And that then is like a airbag in a car. When it's deployed, you kind of push it back. So I have been decompressed since. I've been thinking about 1% of 100 since, and it's a 20-some year journey.
So again, one of the learnings in your journey as you develop this wealth mentality, and I should share with everybody that Wing, you have been a personal mentor to me in this space, that I was on that hamster wheel over 5 years ago when we met, 6 years ago now when we met, trading time for money, exhausted, working long hours, and asking myself, where am I really headed in life? And, I was a bold dreamer, and that's partly why I founded Physician Empowerment, but struggling with the ingredients that I needed to get where I was going. So you talk about taking 1% from people, but that sounds like team building to me. Tell me about a little bit of the team building journey that you've gone on, because you started out in solo practice. Now you're part of a large group practice. So that's practice transformation. We teach that in our small groups, but just give us a little bit of a teaser as to what that means for you.
Solo practice means you do everything by yourself. If you got to do it yourself, right? So we always have that mentality, right? That we do it ourselves. And that's got to change, right? If you want to learn to leverage, learn to go exceed yourself, that you got to decompress and learn how to work with other people. So then I worked, created a multidisciplinary clinic. We ended with 6 physicians. And then I was ready to give up my practice. I was so burnt out with the provincial healthcare, yada, yada. And then I went to a conference, came back. I dug out my residency dream. I said, I want to build a wellness center. And fast forward about 11 years ago, we built this giant clinic, 75,000 square foot wellness center. The clinic, family medicine clinic, as the anchor tenant. So right now I have 30-some colleagues. It is one of the largest clinics in the province, right? And we do panel size about 60,000 patients, which is half of the county. And the building serves about 2,000 clients a day, like with all the paramedicals and medical services. Yeah.
Yeah, because you have a whole bunch of specialists there, as well as, pharmacists, chiropractic, physio, all of that.
Yeah, exactly.
Yeah. So very comprehensive. So this is living a dream for you.
It is a living dream, yes. And it's not just my dream. People embrace it now. It's a lot of people's dream come true. A lot of people's dream practice come true.
It's a shared dream. Yeah. And I remember you talking about how important it's been for you to ensure that every physician within your group feels cared for and valued, right? That the strength of the clinic depends on the well-being of every individual physician.
Correct. Yeah, exactly. You would only win if everybody wins, right? That's the big win. And that's one of the transformation of the thinking, right?
Let me just segue into what that is. That's a wealth mentality, right? That's the idea that the more generous we are with the people in our lives, with our communities, in terms of our time, our expertise, and even our money, the more that comes back to us, right? Because people want to join with someone who radiates that. And so it's that prosperity mentality, right? Like, because we're in a group practice doesn't mean that we're taking from one another here, that we're reducing one another's billings or increasing one another's overhead, that we can actually come together and, in more practical terms, boost revenue and reduce relative overhead, in addition to delivering better practice or better medicine in our practices and delivering better care for our communities. And I'll just put a little plug there, because Synergy Medical sees about, I work in the hospital as an ER doctor, a few blocks away from Synergy, and it sees 10 times more patients per day than my entire hospital. So it really speaks to what you've built, Wing.
Well, thank you. And the part of the learning is to learn to think outside of the box. I think we went to school to be the best that we could be professionally. Since pre-med days, we study for ourselves. We get a good GPA, get a good MCAT score, get in, and then you learn, and you always for yourself. It's just one off, right? But when you go into the real world, you got to drop that thinking and do team play. In fact, I came across a concept that is a couple hundred years old, And in our masterclass, we're actually diving into this. And this is called the 3 dynamic T's, the 3 dynamic T's of success. So in the real world, to have professional success is not just your GPA or how smart you are, how special you are. It's about 3 dynamic T's. And the first T is time. Second T is talents. And third T is treasure. So when you manage these 3 T's, then you and your team will be unstoppable. So a masterclass is going to go through a lot of this in-depth thing. So we invite everybody to check us out on a masterclass, which is a 12-month program. You start the one on time. So if you can manage time, manage talents, which is people and teams, other people's talents, and you can manage treasure, which is money, then you would truly be successful. In fact, even whether you work for fee for service, capitation model, or a fixed budget, or you work for public health, each enterprise, whether it's public or private, to be successful, these 3 dynamic T's need to be worked on.
Yeah. And this really speaks to another core physician empowerment concept called you is the most important investment. And really what that is the idea that, your practice, your financial stability, your personal well-being depends on constantly investing in yourself as an individual, right? That it is not about just endless personal sacrifice, but that we are, focusing on our well-being in terms of, sleep, exercise, eating right, and maintaining healthy relationships. And that this is something, we pay a lot of lip service to within the profession, but being mindful that as fee-for-service earners, the vast majority of us, or at least all of us, trade time for money in our clinical work, the importance of being able to stay in this, not as a sprint, but as a marathon. And so time is a key component to that. And even being able to outsource, being able to trust professionals in our financial and practice lives so that we are focusing on the most important tasks, I have found to be personally transformative along that journey when you talk about that T. Do you want to talk about talent as it relates to delegation and outsourcing, Wing? Because I think that's another important topic. And if I can be blunt, and we try to be straight here on physician empowerment, let me be blunt. Many physicians struggle with micromanaging. I certainly have done it over the years, right? So we have this mentality of, well, if I want it done, I got to do it myself and I got to do it properly. And that means it's going to be me. And let me be the first to say that is exactly what I want out of my surgeon. If somebody's cut me open, I want to make sure that my bowels are getting sewn up extremely meticulously, right? And the same goes, when I'm caring for critically ill patients and these sorts of things. But as we zoom the lens out a little bit and look at how our clinics function, how our hospitals function, how our financial lives function in terms of, whether it's real estate or investing in the markets, that micromanaging can really trip us up. And it's not only in terms of not reaching our financial goals or our practice goals, but even in terms of our well-being, that there is a limit to how much any one person can micromanage before they start to really hit the wall and become exhausted. So tell me a little bit about that then, Wayne. Talk to me about that second T, talent, as it relates to delegation and outsourcing.
The micromanagement, I think it's our trademark. If you look up the dictionary, you see our pictures in there. and the micromanagement thing, other than just being super focused on success and no error, no mistake. We're a very mistake adverse culture, because if we make mistake, people die, people suffer, and we lose our license potentially. We get complaint, blah, blah, blah. So we're very mistake oriented culture. So we don't trust people, right? So micromanagement issue is an issue like you need to see a therapist for, right? It's a mistrust, the lack of ability to trust others. And I think the many more years we stay in tertiary care, the more we do that. So the first thing is to undo some thinking deep down. You give yourself permissions, right? I've learned a long time ago, if you give yourself some permissions, you can actually learn to decompress and learn and grow. And first thing like was, I'm not the smartest guy, right? And I think as a family physician, as a primary care provider, it's easy for me to do because I always refer, right? But even specialists, they specialize in one field, but they would always refer out. They'll say, this is not my field, right? So I don't need to be the smartest guy. I'm not the smartest guy. So there are lots of talents out there. There's an ancient Chinese saying, 3 people walking, 2 of them are my teachers. Okay, this is actually a saying from Confucius, and he's not confused, right? And so that is so true. We can learn from everyone from the team. So thinking change number 1 for talent, right? Hunting talent is I'm not it, right? I need other people that grows. If I'm not the smartest one, I need other people that grows to the next phase, which is called interdependence, right? We become from dependence to independence, and then now interdependence. And I think that is a breakthrough. It's easier said than done, but we got to lean on it. And our healthcare is morphing, man, right? If you look at how we do things in hospital, we have robotic arms now, right? Da Vinci's, right? The people from third world with a surgeon here working with a surgeon there, right? Like we're changing. We're being expected to work with paramedical professionals. Right, they're NPs writing orders right next to you, and you.
Our NPs at the hospital are phenomenal. I feel very privileged to be working with our NPs because I feel like they help create one of the best emergency departments in the country. Right, and again, that was a process, right, of learning to work, in an interdisciplinary mindset and learning to let go a little bit, and it's been just great.
Yeah, exactly. And once you respect people for what they are contributing, even down to the most, quote, junior person, right? I think we have this elitism. That's another one we need to fight against, right? These are cocooning off that shell, one of which that leads to pride and arrogance, honestly, is that elitism, right? Like I'm holier than thou and smarter than thou. I belong to the smartest group, right? I think the sooner we break away from that and we say, hey, we need each other, the sooner you respect the talent, right? And the talent is in things that you might not think is important clinically, but is very, very important. One example was there was a study going around with complication rates in ICU. They found that the ICU, the highest performing ICUs across the country with the lowest complication rate come from one single parameter: how easy it is for the lowest ranking person with least knowledge, how easy it is for that person to say, hey, I think we got a problem. And the ICU group that had even the janitor or anybody, right, supportive staff would say, hey, I think we got a problem. If the team listens to that, bingo, they have the best safety and least amount of complication.
They have that parallel in the airline industry, right? Where everyone is empowered to speak up and errors when they are caught are actually celebrated. And I think that's very powerful. So let's just shift a little bit here, staying on this second T, talent. Talk to us about our financial lives. Like another one that I see physicians do. I mean, I see physicians not wanting to pay an accountant. They do their own accounting. I see physicians who do their own bookkeeping, which is just, I feel like overwhelming for me. I see physicians trying to manage their portfolios. Talk to us about that, right? Because I see the whole spread, and it's not just about making gains financially and managing that other T, treasury, but it's about like our well-being. I mean, for myself personally, working, a 10-hour shift in the Emerge, coming home and trying to like stare at my books, trying to pick stocks feels absolutely overwhelming. And I'm certain I would screw that up a whole bunch. And in the couple of times that I've tried it, I have screwed up massively and learned my lesson. So I outsource, right? I have professionals that manage real estate for me, bookkeeping, accounting, and my equities. So talk to us about that in our financial lives, that micromanaging, because I think that's another big one.
So the talent in the personal finance and corporate finance world is even more pertinent because you cannot do it all. Right. So the DIY mentality goes right back to the mentality that I'm the smartest one. I can't trust anyone. Right. And if you want to be that special, you're guaranteed to be small. The S is not Superman. It's like you are super small. So you got to trust people. And if you become a specialist, then, okay, I DIY and I do stocks or do crypto. Good for you. It becomes a habit, a hobby. Good for you. And we're not knocking anybody, but it's a team sport, right? We went to school to play solitaire, but then when we graduate, this is a team sport, right? And so you need to learn how to do a team. And so in finance, more importantly, is a team sport. You need team members, each with their strength. They don't have to be perfect, right? You have the accountant, you have the lawyer, you have a bean counter, you have a guy who, it's just like Dorothy going to see the Wizard of Oz, right? She's got all these characters that each have their defects, right? One has no courage, one has no heart, one has no brain, right? And so these actually, I have a talk that puts it into all your consultants.
To come back to your point, Wing, there's a bit of an element of humility. I'll just share one personal story that actually came from today. And you helped me with this. I have a property that I can't sell. I can't rent. And so I'm putting on Airbnb, and I've hired a company to do that. I outsourced, and it's eye-watering. They need a $45,000 check to get the house ready, to stage it, to furnish it, everything. And, I was so tempted to just like move funds from my PC, pay myself that $45,000, and then write the check off to this company. And I paused and I phoned my accountant. I rarely have any answers in this space. I only have questions, but I'm thankfully very fortunate in that I'm ready to ask questions, even the so-called dumb ones. And I just go ahead and ask him. I said, is that smart? Or should I be loaning money from my PC? Or should I be using a line of credit? And he said, based on, the nature of the purchases and the property and everything else, line of credit. Wow. Right? Huge tax saving, thousands of dollars right there. Huge pressure off me. I'm so happy I did that. Maybe, $100 for that phone call, worth every penny of it. Right. And so that's a growth for me, right? That's, learning to be humble enough to ask questions, understanding that I don't have the answers. And, we actually do this in practice. When I'm in the emergency department, I feel like I'm in over my head. I pick up the phone, I call a consultant. When we've got a patient in front of us in clinic, we refer on to a consultant. I mean, you mentioned that earlier, Wing, but it's important to think about that in terms of our financial lives as well, which I think is so powerful. So that was like actually today, off went the check.
You shared and you demonstrated that you actually picked a team member that is valuable, right? So, but if you didn't pick the right team member, you won't have got that answer. So part of this talent thing is you become a talent agent, right? People ask me, how do you do such big projects? I said, oh, it's easy. I chum around people who are smarter than me, right? If your why is big enough, the house would come to you. I'm not good at engineering at all, right? I one day I found myself in the room with 18 engineers around me and 2 architects building this big senior project that is today worth $52 million that we just launched last year, right? So here's the brightest engineering minds in the city, and they're circling around me asking me questions. Well, I chum around with people who are way smarter than me. So when you put the right team together, so it's a talent show, right? You hunt for the talent, and you hunt for the right talent for the right thing, and then you're going to win. You're going to win because you got the best team. You got the A team. I'm dating myself about the A team, Mr. T.
Yeah. But it's true. And, like certainly this Airbnb thing that I'm doing, it is not cheap. I am paying a lot up front, and I'm paying a lot for management fees, but I am so much happier. Number one, I know it's going to work far better than if I did it myself. And number two, more importantly, I am happier because I do not want to be going and trying to turn over a space and micromanage cleaners and everything else, right? It's about our personal well-being along this financial journey. That is not simply about getting to a certain number, a certain net worth, a certain cash flow. It's really about building a financial plan that works in our personal lives, right? That works with our practice lives. I think that's so important, so important.
Exactly. The other example is tying the 3 T's together. Is if you DIY everything yourself, you're going to miss some advice. And tax is single-handedly the biggest expense in our life. And if you don't get the right tax advice, or worse, get the wrong advice, you could be wasting a lot of money. I spent the time, sought out a smart guy in insurance and in tax, and I went home, ran it by my team, and I saved about $350,000 in tax based on that one piece of advice.
Yeah, that is exactly it. And you know what? We have seen that at our physician empowerment conferences. People come up and they go, oh my goodness, I wish I knew this 20 years ago. And it's never too late, right? Like that's the most amazing thing about anything in life, any stage, anything in life, is that nothing is ever too late. So if you have those kind of questions, start asking them, right? Start going to people, start building that team, begin now. It can be so powerfully transformative. And I have missed out on far more deals than I've been a part of. And that's okay. Because guess what? Warren Buffett didn't buy Walmart, didn't buy Amazon, and he's doing just fine, right? So it is never too late to be okay, and better than okay. It is never too late to thrive in our financial lives and in our practice lives. Tomorrow is always a new day.
So more important than the actual talent that we thought we need to possess is to ask the question why, and to ask the right questions. What questions are we supposed to ask? Now, interestingly, the word knowledge, which is a Greek word, but in Chinese, the word knowledge is actually 2 characters: learn, ask. So knowledge in Chinese thinking is learn to ask question. So the more knowledge you got, that means that the more questions you learn to ask. You just ask smarter questions, right? So what we hope to empower people at Physician Empowerment, it's a peer-to-peer empowerment process, so to empower you to ask better questions to your own team. How to assemble the right team, keep asking questions. And in doing that, you have an enlightened path, right? And then you can reach your own goal, which is different than mine or yours, right? So,
yeah, I love that. I absolutely love that, Wing. So I think we're going to actually start winding it down. We don't want to make these too heavy. We don't want to make these too long. And I'll just share a little bit of my own wellness with those that might be a little bit late joining, is that I'm about to go water skiing and it's a beautiful summer night and I'm not going to miss that. Anyhow, being out on the lake, on the boat, it's going to be great. So we are going to wind it down here. I've really, really, really loved this. I'm always inspired when we talk like this because it's these bigger questions, right? It's learning to take risk. It's learning to ask the big questions why. It's learning to be humble enough to reach out to people in our practice lives and our financial lives that are going to help us soar, that it doesn't have to be a one-person show. So we have quite a few people who've joined us in the webinar, and I'll just put it out there briefly for anyone that wants to ask questions. Go ahead and type them into the chat. But otherwise, I'm also just happy to wind it down because this was great. And this is only a start of what we're going to be covering in this area, because there's so much. You know what, when I reflect on practice success or financial success, it's about grit. And this is some of the process of building grit, just that inner toughness, that inner resiliency to keep going when you feel like giving up. And so I'd invite anyone who's interested, just reach out to us, go on the website or sign up for our emails. But like, we are super accessible. You can reach out to us over email, phone. And if you want to know more about like our master class or conferences, we're always happy to talk about them. But at any rate, I think I'm going to wrap it up there. And I really want to thank everyone for joining tonight. And Wing, I really want to thank you again for just sharing so much wisdom.
Well, thank you. It's always fun, and we hope to see more of everyone. Thanks.
Thank you so much for listening to the Physician Empowerment Podcast. If you're ready to take those next steps in transforming your practice, finances, or personal well-being, then come and join us at phys-empowerment.ca, PHYS empowerment.ca, to learn more about how we can help. If today's episode resonated with you, I'd really appreciate it if you would share our podcast with a colleague or friend, and head over to Apple Podcasts to give us a 5-star rating and review. If you've got feedback, questions, or suggestions for future episode topics, we'd love to hear from you. If you want to join us and be interviewed and share some of your story, we'd absolutely love that as well. Please send me an email at kmilo@phys-empowerment.ca. Thank you again for listening. Bye.